Okay, I'm going to go ahead and get started. My name is Kelly Myers, and I am going to be presenting the Medicare 101 webinar for you this morning. Again, I appreciate you guys all jumping on to take the time out of your day to check this out. Um, I will begin with just going over some of the basics, and so we'll just get started. So the things that we're going to cover today is what is Medicare. I'm going to go over a couple of the basic terms that are used in Medicare and basic insurance, actually. I'm going to show you a copy of the Medicare claim card, go over original Medicare, which is Part A and B. I'm going to go into some details on the Medicare Advantage and PDP plans, which is your Part C and D. Also going to talk about MACRA and how it affects Medicare. That's something that just went into effect January 1st of this year. So that is something fairly new. And then I will go over the Medicare supplement plans, who can. What is Medicare and who's eligible? So it was signed into law by President Johnson in 1965. Currently, within the first 12 months, there were 19 million enrollees. As of today, we are at approximately 58 million. So it's obviously a very large group of people, more and more eligible enrollees as the years go on. Some of the changes that have been made to Part A and B, in 1972, there was coverage offered for those beneficiaries who are under age 65 as long as they were on Social Security disability. In 1980, supplemental insurance plans were standardized. 97 is when the Medicare Advantage plans were introduced to the Medicare world. And 2003 is when the Part D, which is your prescription drug coverage, was introduced. And then in 2010, ACA was introduced, which is a no-cost preventative service with a reduced Part D donut hole, which we'll get into the donut hole a little bit also as we go on. I know that can be kind of confusing for people. And then in 2020 is MACRA, which I spoke about earlier. It no longer allows newly eligible employees to enroll into plans that cover their Part B, as in boy, deductible. So we will get into that a little bit also as we go on here. Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by the Medicare tax that you pay while you're working, and it is a form of individual health insurance. So let's talk about who's eligible for Medicare. So just like the previous slide, you have to be a U.S. citizen or legal resident for at least 5 years in a row. You have to be 65 or older. You can be under 65 if you have a qualifying disability and you've been collecting Social Security benefits for 24 months. And any age with a diagnosis of end-stage renal disease or ALS. So anyone who falls into those categories, they are eligible to apply for Medicare. So I'm going to go over some terms with you, and then I'll show you a copy of the Medicare card because it has changed recently. So some of the terms we're going to go over: premium, deductible, copay, and coinsurance. You probably, unless you're brand new to insurance world, you probably are very familiar with these terms. So you know that a premium is the fixed amount that an individual will pay for their coverage. It's usually a monthly premium. Your deductible is the set amount that you pay for your covered services before your plan will pay for anything. Your copay is the fixed amount that you pay at the time you receive a covered service. And coinsurance is the amount you pay when the cost of a covered service is split with you, between you and the carrier, usually a percentage such as 80-20. So carrier pays 80% of your cost, you pay 20%. And I did forget to mention that if you guys do have questions, everyone's muted, but if you have questions, feel free to type them in the chat panel, and I will do my best to get to those as we go through this. So here's a copy of the old Medicare card that beneficiaries would receive once they enrolled into Part A or Part B. The new card, the old card was the member's Social Security number with an alpha number at the end, and each of those alpha numbers or alpha letters stood for something. And there was a whole chart that laid all that out, but due to security and privacy and, you know, keeping the client's information secure, they, instead of throwing their Social Security number out there as the claim number, they have updated it to a combination of 11 letters and numbers, and they are just randomly selected. There's no rhyme or reason to that. And I do want to point out that CMS will never use the letters S, L, O, I, B, or Z. I think that's something handy to note. I would jot that down because sometimes, especially if you're taking a paper application, it is hard to read what they write on the app, or you don't know if it's a 0 or an O. So you won't even have to worry about trying to decipher what is what when it comes to something like that, because you know that the letter O will never be used, so that's obviously going to be a 0. So that's just some handy information that I like to keep nearby as a reference. And you always want to make sure you get a copy of their Medicare card before you try to enroll them in anything, just to be sure that they are actually enrolled and you're getting their information that's correct, their correct Medicare number, and their A and B effective dates, because those are very, very important. Now we will go into what Part A and B is of Original Medicare. So the coverage choices, once you are in A and B, or A or B, you can do either one. You don't have to be on both at the same time. So you'll enroll, the client will enroll in Original Medicare, and then after that, they'll decide if they want to go with a prescription drug plan paired with a Medicare supplement plan, or if they just want to go to the Medicare Advantage plan with the drug coverage. So those are their options that they have when they first get onto Part A and or B. And I'll go into some detail on each of these as we go through. So Part A we'll go over first, which is your hospital insurance. So that's going to cover things like inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. So they will definitely want to check with their carrier, their policy that they're on, and with their doctor to see if the type of blood transfusion that they are having done is covered or not, because not all are. And here's a look at some of the costs for 2020 for the Medicare Part A, which usually is 0 for most beneficiaries. And that is going back to where I had mentioned that Part A is covered by the Medicare tax that we pay during our years of work. So most people qualify for that 0 premium. If you do not qualify for that 0 premium, it can go all the way up to $458 a month for Part A, which you don't see that very often. It's most typically 0. The deductible is for this year, for 2020, is $1,408 per benefit period, up to 60 days. There are other costs, $352 per day for days 61 through 90 in one benefit period, and $704 per lifetime reserve of a maximum of 60 days. And then just to note that there is no out-of-pocket limit on the Part A. Part B. Part B is going to cover your doctor and your outpatient visits. So anytime you go see your physician, you go to the hospital for something that they send you home for, if you need an ambulance, outpatient mental health, lab services, your durable medical equipment, like your oxygen tank, wheelchairs, your outpatient physical and occupational and speech therapies, and then some preventative care is covered under Part B. And again, that's just something that you need to look into before you go to do the preventative care to make sure that whatever it is that you're having done is covered. And the Part B cost for 2020, the standard premium is $144.60. That does vary based on your income. So we will get to that too. The higher your income, the higher your Part B premium is going to be. But the standard is $144.60. The question is, will there be a way to get a copy of this presentation after today? Yes. We will send a copy of this out to everyone. There will also be a recorded copy of the webinar on our website. And our website is Cornerstone Senior Marketing.com. And again, this will get emailed out to all of you, and if you lose your email or can't find it, you can always go out to our website and pull it up, along with any other webinar that we've done so far. So the Part B deductible is $198 for the whole year, 20% of the approved amount for most covered services, and then there is no out-of-pocket limit for the Part B as well. Okay, and like I was saying, the Part B was based on income, so here's just kind of a reference piece. You can see an individual tax return of $87,000 or less, and a joint of $174 or less. Your premium is going to be $144.60. So a majority of the beneficiaries do fall into that category. And I know this says 2019 Part B premium, but you can see at the top it's the information that they're providing here. So as I said, the higher your income, the more you're going to pay for your Part B premium. So what's not covered under Part A and B is the deductibles, co-insurance and premiums, your Medicare Part B excess charges, which is the amount that is billed over what the Medicare amount, approved amount is. Your prescription drug coverage is not covered under Part A or B. Additional benefits such as hearing, vision, and dental, those do not fall under Part A or B. And your long-term care or custodial care. Most nursing home care is considered custodial care, so those are not covered under Part A or B. So that's, these are all reasons why we have the Medicare supplement plans and the Medicare Advantage plans and the Part D plans, which we're going to be getting into here soon. So here we're going to talk about the Medicare Advantage prescription drug plan and the standalone PDP plan, which are labeled as Part C and Part D. So Part C is your Medicare Advantage, Part D is your prescription drug plan. So the Part C Medicare Advantage plans, it is a combination of Part A and B. So if you don't have both A and B, then you cannot enroll into a Medicare Advantage plan. You have to have both. And most Medicare Advantage plans do include prescription drug plans or prescription drug coverage. There are very few MA-only plans. They are offered by private insurance companies, and additional benefits are included in a lot of the plans. They offer the vision, the hearing, some wellness services, like transportation, food, things like that, and the nurse phone line for support. The eligibility for Part C, like I mentioned, you have to be enrolled in Part A and B. They do have service areas, so each plan has a certain area that they cover. So a plan that is in Franklin County isn't necessarily in Delaware County. So you definitely want to check before enrolling a client into a Medicare Advantage plan to make sure that they actually live in the service area where that plan is available. Otherwise, that app's going to get denied. Eligibility is not affected by their health or financial status, so there is no underwriting, which is a good thing. Most do not have end-stage renal disease, or must not have end-stage renal disease, but there have been some changes to that. So there are some like dual SNP plans that offer coverage for into and make sure that it is available in your client's area, because those also do have the service area. The different types of Part C plans, there are HMO, PPO, SNP, the special needs, which is what I was just talking about, and chronic and all of that, the health maintenance organization point of service plans. They're also offer private fee-for-service plans, which are very rare these days. You don't see a whole lot of those. Some fast facts on Part C is that the plan premiums and terms can change from year to year. You have to continue to pay your Part B premium each month, as well as your Part A if you don't qualify for the zero premium Part A, which most people do. But the coverage is convenient. It's got your health and medical and some dental, vision, hearing, all of it wrapped up into one plan, so you're not dealing with the Medicare Supplement PDP where you have two separate plans, you can even have two separate carriers, two separate ID numbers. With the Medicare Advantage plans, it's just all combined, bundled into one package, one carrier, one ID number. The coverage is limited to service areas unless it's an emergency. So if your client is on a plan and they are traveling and they're not in their network, they can still see a doctor or an emergency room or whatever for anything that's considered an emergency. So that will be fine. They may be required to see doctors and hospitals that are included in the plan's network to get the cost of the coverage of the plan. If they go out of network, they will have to pay a higher cost. They can go out of network, but it's just going to cost them more. And additional benefits not covered by Medicare, like dental, vision, and hearing, preventative care, those are all bundled in to that one plan. Now we will move on to your prescription drug coverage, which is Part D. This plan is what's going to help you pay for your prescriptions. It is only offered through private insurance companies, and you must continue to pay your Part B premium. So with the Medicare Advantage plan I mentioned, you have to have both Parts A and B. With the Part D plan for your prescription coverage, you only have to have one or the other plan. So you do not have to have both. You have to have one or the other. With the prescription drug coverage, the amount that you pay for your prescriptions can change over the year because there is 4 stages with the Part D plan. You have your annual deductible. Now this is the donut hole that I was talking about in the very beginning. So you start off with your annual deductible, then it goes into your initial coverage stage, coverage gap stage, and then your catastrophic coverage stage. And I'll get into more details as we go on those, but those are the 4 stages of your Part D prescription drug plan. The amount of money that you pay will change depending on which of those stages that you fall in. So many people will stay in an initial coverage stage for the whole plan year. If you take a lot of prescriptions, high cost medications, you will move into the next stages. So the more money you put into this, the further along you go in these stages. And the coverage cycle will start over on the 1st of January for each plan year. So there's no carryover, basically. And here's how it works. So you start off in your deductible stage where you're going to pay zero, which is what most people pay, and depending on your plan and depending on what your premium is. Your initial stage, coverage stage, you pay your copay based on the tier of medication that you have. Your initial coverage limit is $4,020 for 2020. So once you hit that, you go into your coverage gap, which is the donut hole. This has recently changed for 2020 as well. It used to be more expensive, but now brand names were more expensive than generic. You were paying a higher percentage for those, but now this year they've made it so that everyone pays 25% for all of your drugs, brand name and generic. So that's really good for 2020 this year. That's changed, lowered. Okay, so then once you hit your out-of-pocket limit, which for 2020 is $63, where you only have to pay 5% coinsurance, or the $3.60 or $8.95 copay for your covered drugs, whichever is greater. Most people do stay in their deductible stage, but there are people who are, have those high-cost drugs that they have to take a lot of, and a lot of different kinds. So those are the ones that you'll see hit that catastrophic stage. So going back to the tiers, and it's all part of the formulary that they have. So a formulary, and each plan is different. So one PDP plan might cover a handful of drugs that another PDP plan does not. So you always want to check the formulary specific to the plan that you're looking at for your client. The tiers are 1, 2, 3, 4, and 5. The higher the tier, the higher amount the client's going to pay. I believe there's also some tier 6s as well. That's not showing here, but so tier 1 is your cheaper drugs. Tier 5, 6 are your costly drugs. Let's see. Some fast facts about Part D is the prescription drug coverage varies from plan to plan. They aren't all going to be the same. The premiums will be different. The covered drugs will be different. There is no service area for Part D drugs, though. Part D plans are available throughout the state, so you don't have to worry about if your client is in the service area for the plan that fits them the best. Catastrophic coverage protects you from very high drug costs. So again, those clients who are on the tier 5, tier 6 drugs, and they hit that catastrophic phase, that's going to drop their payment on their drugs significantly. So that's very helpful to those clients who are in that situation. And the benefits can change each year. So if you leave someone on the plan that they had last year, it's not necessarily going to be the same coverage for the following year. So you always want to check in on that every year, make sure that your client is still on a plan that fits their needs. Each plan has a list of drugs that it covers that I talked about already. That's the formulary. You want to make sure that your client's drugs are on that formulary before you enroll them so that they are covered. And the formularies do change each year too, or they can. So you always want to check that each year as well to make sure that your client, their medications haven't changed. And if they have, check that formulary to make sure that that is still the right plan for your client. The coverage is not automatic, so you do need to enroll your client. It's not going to be automatic. Like Part A is automatic, Part D is not. So it is a plan that you have to enroll in. If you don't enroll in Part D when you're first eligible, you will receive a late enrollment penalty for Part D, which we'll get into that a little bit here too. Oh, maybe not. I'll just go over that real quick, sorry. So it's 1% of the national average is what is added on to the Part D premium for a client who fails to enroll when they first become eligible to do so. And when I say first become eligible, that is when they are first eligible for Medicare. So when they have A and or B and they don't pick up a prescription drug plan, whether it be through their employer, as long as it's a credible drug plan, that they're on, they can stay on that and not get a penalty. But if they have no credible drug coverage when they become eligible for Medicare, when they go to apply for that plan, they will be, they will have a fee tacked on to their premium, and that'll stay with them for the rest of their life. So when can someone enroll? Annual enrollment period is from October 15th to December 7th. Enrolling for the first time or switching plans during AEP, and effective date for all AEP applications is going to be January 1st. So AEP starts October 15th and ends December 7th. The effective date for all of those applications that use the election period of AEP, those will all have a January 1st effective date. Your initial enrollment period is IEP. That is when you first become eligible. So it's a 7-month period, so you'll have 3 months before you turn 65, the month that you turn 65, and 3 months after you turn 65 to enroll into a Medicare plan. So the client has plenty of time to check out plans, and you have plenty of time to help them out as long as you know when they've turned 65 or when they are actually eligible to enroll. Their effective date for IEP is the first of the month following the enrollment or the first of the birthday month. So if you have a client who's enrolling for IEP and you submit an application in June and you want an August effective date, they will not give you that August effective date. They will give you a July 1st effective date. So if you're using IEP, you need to make sure that you're submitting it the month prior to the month that you want an effective date of. We have a question. If a Medicare eligible employee or owner has not enrolled in Medicare, but has a non-credible prescription drug coverage, $6,000 deductible, high deductible health plan, will the penalty apply? Oh, that's a good question. Not enrolled in Medicare, has a non-credible RX coverage. Yes. If it's not considered a credible drug coverage policy, then they will receive that late enrollment penalty. It has to be considered credible coverage, something as good as or better than the Medicare Part D plan. Anything else is considered void, and they will get that penalty. All right, let's see what's next here. We're going to go into a couple more enrollment periods here. So then you also have your special enrollment periods, which is referred to as SEP. This is a period when a client can switch a plan due to special circumstances. Let's say they've moved out of the service area. You enrolled them on a Medicare Advantage plan for Delaware County. Well, they're moving to Franklin County, and that plan is not available in Franklin County. That is going to trigger an SEP for them. So they will have that availability to enroll, enroll into a new plan because the plan that they were on is not available in their new service area. Same with if you are on employer group coverage and you drop your employer group coverage, that gives you an election period to enroll into Medicare Advantage, PDP, Medicare Supplement, because you're losing coverage. You're coming off of coverage. As long as there's no more of a 63-day gap, they have that enrollment available. So there's certain circumstances like that that will allow a client to enroll outside of AEP and outside of IEP. And each carrier does have an election period guide, which is very helpful. And if any of you guys want me to send you one, I can. Just let me know. Shoot me your email in the chat box, and I'll get you guys a copy of an election period guide so that you can kind of go through and view all of those. Now we're going to talk about MACRA, which is what I spoke about in the very beginning, that this is what has changed Medicare Supplement to where newly eligible people for Medicare, So if you're newly eligible, which means you were able to get Medicare, you were eligible for Medicare January 1st, 2020 or after, you are no longer able to purchase a Medicare supplement plan that covers the Part B, as in boy, deductible. So we'll go ahead and get into that and how this works. So first of all, MACRA stands for the Medicare Access and CHIP Reauthorization Act of 2015. It's often referred to as MACRA 2020 because even though it was signed into law in 2015, it did just go into effect on January 1st of this year. Basically, it's a pay-for-performance program that focuses on getting the providers to provide better service and have better value, accountability for their work, better quality instead of more care. So it's kind of it's focusing to get the providers to do a better job, basically, of providing health care rather than more of it. And like I said, prohibits the sale of Med-Sup policies that covers Part B deductible to newly eligible Medicare beneficiaries effective January 1st, 2020. So how does this affect the client and Medicare coverage? So if the plan option, okay, so if you have a client who was enrolled in Medicare before January 1st, 2020, and they are on C, F, high deductible F, which those three plans are the only three plans that do cover the Part B deductible. So if they are on those plans already, they can stay on those plans and continue on those plans. Those plans are not changing for anyone that was eligible or on those plans before January 1st, 2020. Nothing's going to change to their benefits. The CF or high deductible will continue paying their Part B deductibles. And as long as the premiums are paid on time, they can remain on those plans, no problem. Now, it's different for those who just became eligible on or after January 1st of this year. So when they select Original Medicare as their health coverage, they have many other options to choose from, and I'll go into what each of those plans are here in a little bit. And they will vary, but not one single plan that they are offered will cover that Part B deductible, which last year was $185. It's a little higher this year, but so that's what MACRA is, I'm sorry. It basically has taken away those Part B covered deductible plans for anyone new to Medicare for 2020. And now we will go into the Medicare supplement, who can buy them, what plans are available, the open enrollment for it. So the Medicare supplement open enrollment is based on the Part B effective date of the client. And to get a Med-Sup, you have to have both A and B. So just like the Medicare Advantage plan, you have to have A and B. The Part D plan, you do not. You can have one or the other. It begins, the open enrollment begins on the Part B effective date, and it is a 6-month-long period. So once your client has Part B, let's say it's effective July, they have 6 months from July to enroll into a plan, a Medicare supplement plan as guarantee issue without having to go through underwriting. That's nice. So if someone is, Part B is effective in July, they can get a 8/1 effective date with no underwriting. The eligibility for Medicare supplement, generally you have to be enrolled in A and B, which I've never seen a plan accept anyone who's not in A and B. Residents of the state in which you are applying for coverage, you have to be 65 or over. There are some states that offer under 65 Med-Sups. I know Kentucky has one with Anthem, but really that's the only one I'm familiar with. I don't see many under 65 come through, but it is possible. There are some plans out there for the under 65 on disability. And anyone who has end-stage renal disease is eligible for a Medicare supplement plan. So going back to MACRA, we have two clients here. We have one who was newly eligible on January 1st of 2020, and we have one who was eligible prior to January 1st, 2020. So as you can see, the newly eligible is not able to enroll into a Plan C, F, or high deductible F, because those are the three that cover the Part B deductible. So the non-newly eligible, she is able to purchase a Plan C, F, or high deductible. Even if she wasn't on one previously, she still is eligible to enroll in one of those plans. If she was on, I don't know, a Plan N prior to 2020, and she wants to switch over to a CF or F, she's able to do that. A little bit more information on the Medicare supplements. The supplements do just what they say. They supplement Part A and B. So it does help cover some of what Part A and B don't. It's offered by private insurance companies. The plan options are A, B, C, D, F, G, K, L, M, and N, and high deductible F. There's also a high deductible G plan. Benefits vary by plan. Generally, the more comprehensive the coverage, the higher the premium, which is the case in most insurance policies. Massachusetts, Minnesota, and Wisconsin do have different standardized plans than the other states. So if anyone's interested in those, I can get that information to you as well. So if you do want to look up some more information on what I've gone over today, there are several resources available. Medicare.gov is always a good one. Everything out there is CMS approved. So you know that that's a legit resource, that everything on there is the real deal. You can also call Medicare if you want. They are open 24 hours a day, 7 days a week. There's also a website, shiptacpacenter.org, or you can call your state health insurance assistance program. If you have someone who has low income, you want to see if they qualify for financial assistance, because there is financial assistance available for these plans for Medicare Advantage and Part D prescription plans. So anyone with a low income may qualify, so you can always call and check on that for them if that's something that they would be interested in. And again, if you have any questions, you can just type them in. We have one here. It says, if over 65 and still working, not enrolled in Medicare, does the MedSup 6-month window begin when enrolling in Medicare? That's a great question. Yes, it does. So if they are not enrolled in Medicare, that 6-month window begins when they enroll in Part B. So based off of your Part B effective date, that's when that 6-month gap opens up for them. So yeah, they can still be over 65. They don't have to be 65 to qualify for that guarantee issue period. It's a great question. Do we have any other questions? Give a few more minutes here. Again, I appreciate everyone jumping on today. It's a good sign to see new brokers getting into it, learning about it, or even if it's just a refresher course for you. And again, this will be emailed out to everyone who's on the line. And if you need additional information, I know we're going into cert season. So each carrier does require certifications be completed, although this year Humana is not requiring it, so that's nice. But if you go out to our website at cornerstoneseniormarketing.com, there is a section out there that will provide you with all of the certification information for all carriers that we work with for 2021. And if you are just now getting appointed with carriers, I would hold off on certifying for 2020 because a majority of them, especially the major carriers like Humana, UHC, Anthem, those all, if you do their 2021 certifications, which are going to start opening up here very soon within the next few weeks, those will cover the remainder of 2020. So once you certify for 2021, if you have a client you want to enroll before AEP starts, you can do that because your cert will cover you for the remainder of 2020. So that's good. So I wouldn't take 2020 just yet because then you'll have to turn around and take 2021. You might as well just wait a few weeks. AHIP did come out on Monday, so you are free to take AHIP if you want. You do have to have AHIP taken before you can take the certifications for the other carriers. I'm trying to think what else I can tell you guys. So again, all of that information is out on our website. And if you have any additional questions or anything, you can reach me at my email. I'll type it in here. If you need me to send you a copy of anything or, like the election period or anything like that, my email is kelley.myers@cornerstonесeniormarketing.com. And we do have an alpha split for our service reps. So if you reach out to me for anything other than what was reviewed in this webinar today, I can direct you over to your service rep if you don't know who that is yet. But otherwise, feel free to reach out to me. I will gladly assist you in any way I can. I, again, appreciate all of you for joining today. It's a great turnout, and I hope you guys all have a great rest of your day. Thank you.